Okay. All right. Well, welcome everybody. My name is Dan Sullivan. I'm a case manager here at Senior Resource Center, and also with us is Scott Campbell. He's our director of operations, and Scott will be handling questions. So I think you're all muted right now, but if you've got a question, by all means, type it away, and Scott will look at them. And as we proceed through these slides and my explanations, I'll be able to try to answer some of those questions. So. Today, we're talking about Medicare. We're in the middle of open enrollment. So for anybody that doesn't know yet, it goes until December 7th. Generally, every year, that's October 15th to December 7th. And that gives everybody a chance to change their plans if they want to. People who are just retiring or about to retire, you have a 7-month window. So 3 months before your birth month, and 3 months after. So you've got a time whenever that falls during the year. So we're going to just try to do a real overview of Medicare. I think our main goal today is trying to make you more informed consumers. So we're not going to be able to kind of make you experts or try to get you to understand every aspect of Medicare. That would take forever. I've been doing this for about 20 years, and I learn new stuff all the time as things change as well. So why don't we get into our slides, and we'll proceed from there. If you got questions, please fire them off to Scott. So if you're not familiar with us, many of you probably are, but we're Senior Resource Center. We're a elder advisory group. We bring together case management, financial guidance, and legal advice as well. We have 5 elder law attorneys here that have decades of experience. We bring those together to try to address any of the needs that our clients may have. And today we're going to deal with Medicare. So let's jump right in and talk about the parts of Medicare. So a lot of people get confused because they hear different things of Part A, Part B, Part C, Part D. It is pretty confusing, but we can break it down to kind of help you make sense of that. So there's a thing that is you may oftentimes hear is original Medicare. So if you are retired or otherwise you're on Medicare already, you likely have original Medicare. That in original Medicare, as you can see there, is Part A and Part B. Part A is what we call hospital insurance. It usually covers most things when somebody is hospitalized. And Part B pretty much covers things when you're not in a hospital, like if you go see your doctor, if that doctor orders some blood work or x-rays, usually those costs or some or most of those costs are absorbed by Medicare Part B. And then to add to that, we have supplemental coverage because that Medicare Part A and B doesn't cover all costs. And we'll get into that more in detail. So that's why people choose to purchase a supplement. And that's really what the open enrollment period is. It's generally for people who already have Medicare Part A and B, and they're adding in a supplement to help cover the cost not already covered by original Medicare. So the supplements are Part C or Medicare Advantage. There are Part D plans. Those are Medicare prescription plans. And then another type of insurance called Medigap plans. And we'll get into more of those in detail. So just another way for you to visualize this, you can see in the screen here, we've got original Medicare is at the heart. Original Medicare will always be the core of your health insurance. So whether you're, newly retired or you're, 95 years old, if you're on Medicare, you will always retain your original Medicare. That's Medicare A and B. And then what we have is supplements to add to that, depending on your particular circumstances. And those things you're able to change. So up in the right-hand or in the corner there, you have Medicare Advantage plan, Part C. You may choose to get a Part C plan. You have multiple choices between that. Or you might choose to pick a Medigap policy instead. And then if you do a Medigap policy, you'd likely pick a Medicare prescription plan to go along with that. And we'll break those down in further screens. So let's start with Medicare Part A. Again, oftentimes referred to as hospital insurance. There's no monthly premium for Medicare Part A. So pretty much anybody who's turning 65 is eligible to go on Medicare Part A. You should, as I said there, if you're still working or you're covered by your spouse's insurance and they're still working, you definitely want to talk with your employer about whether or not you should sign up for Medicare Part A then. Generally speaking, it makes sense to sign up for Part A even if you have other coverage, because it's free, it's going to be no cost to you. And so Part A, it covers 100% of inpatient hospital stays after a $1,600 deductible. And then it covers inpatient rehab at 100% until day 20. And then there's a $200 a day copay after that. It also covers some home care services, and it also covers hospice care services in full. We'll get into a bit more of the details as well as we go on. So Medicare Part B, that basically covers things that you encounter in the medical community outside of a hospital. So there is a monthly premium for Medicare Part B. Generally speaking, most people fall into the category of the standard premium, which in 2023 will be $164.90 a year. I'll have a chart that shows if your income is greater than that, there is a kind of like a sliding scale for that premium, and I'll explain that to you then. There is an annual deductible, so anytime you utilize your Part B, you have to pay the first $233. There are ways to avoid that. We'll talk about that later as well. And so generally speaking, Medicare Part B is only covering things itself at about 80%. So you'd be responsible for 20% of any kind of cost you incur while utilizing your Medicare Part B services. And there's a big disclaimer there: beware of the late enrollment penalty. So we'll talk about that a little bit more as well. But if you should get Medicare Part B and you don't, there is a penalty that goes along with that the longer you avoid getting that Part B. So that's just something to be concerned about, and we'll talk a little bit more about avoiding that penalty. So Medicare Part B, do you need this coverage? It says, so your decision to get Medicare Part B at 65 or 66 when you're retiring, your decision to get that depends on kind of a cost comparison with other healthcare options you have. And again, that would be if you still continue to work. We have many people nowadays that work well beyond 65, and they're continuing to get their employer-based healthcare insurance. And so you don't necessarily need to get Part B at that time. As long as you have what's known as creditable coverage. That means, generally speaking, most insurance offered by employers in Massachusetts is creditable coverage. And as well, if your spouse is continuing to work and you're covered by them, you may not need to get Part B. But if you're,
I'm sorry, Dan, we have had a couple of questions here, and
sure.
And I'm not sure if we want to hit them now or wait till the end.
It might be a good time. This can be a confusing part of this, and if I've gone too fast or something like that,
nope.
It'd be good to grab a question.
Great. So we to answer kind of a few right off the bat, we are recording this. We'll be posting this on our Facebook page. That's one question. And will the slide deck be available to participants? Absolutely. Well, I'll put my email in the main chat session, and we can send them out that way. We did have two specific questions, and as I'm writing this, there might be more. That there was a question on signing up for Medicare as opposed to supplemental coverage, that the individual was still working full-time and turned 66 in January and planning on retiring next summer. Where do you sign up for Part A? And then just the other, which I think we're going to get to that in a little bit. And another question was currently working full-time, I plan to retire next spring. Presently, you plan to apply for Medicare Advantage plan at that time. I've heard applying for Medicare supplemental plans allow 8 months after terminating employer insurance, but for Medicare Advantage plans, you only have 2 months. Is there a penalty if I miss the 2 months? So there you go.
Yes. Okay. So yes, if you're not retiring now and you're planning to retire in like a year or so, you're probably best off if you would sign up for Part A, just get that out of the way. And then closer to your retirement time frame, you know, these slides should not be meant kind of as your go-to and all that you need. You should definitely speak with an experienced individual. At the end of the slides, I have a contact phone number for scheduling an appointment with a Shine counselor. So if you're a client of ours, you're welcome to call me. But if you want, you can also speak with a Shine counselor. These Shine stands for Serving the Health Information Needs of Everyone. And so these are volunteers who are trained in all of this information. I went through the training myself a couple of decades ago, but they help you kind of break down what your needs are and then show you what the options are. And after we run through these slides, the second half of our presentation today, I'll be going through the Medicare website. The Medicare website has what we call the Plan Finder tool, and it's the only real way that you can decide which plan is best for you. You can't talk to the guys down at the Elks. You can't talk to anybody else about this. You really need to enter your information and find out the cost associated with what insurance would cost for you individually. And that's one of the things that we'll be going through in our presentation today, is getting you up and running on utilizing that Plan Finder tool. So, all right, I think we can go on the other side. So here this is just a rough breakdown to kind of give you a comparison. So for a couple of you that are, you're going to be continuing on your employer's health insurance, you would have the opportunity, and most employers would probably allow you to have that opportunity. You could drop your employer-based insurance even if you were going to continue working, and you could go on Medicare. So here's just a rough breakdown of costs. So again, Part A is free. There's no charge for that. Medicare Part B, for most people, but not all, it's $164.90. And then Medicare Part C, if you're choosing a Medicare Advantage plan, they're not all the same. We'll look more into the cost associated with those, but an average premium is $35. Now, there's certainly plans that are zero premium, but there are other plans that may cost you, over $100 a month for a premium. So that's just an average. And then, typical copays in a month, it could be $35. It could be nothing. It could be, a few $100s, depending on your particular circumstances. But you can see the breakdown of the types of costs you'd be facing if you went on Medicare. So we come up with a figure of, this is, again, hypothetical, just about $235. Employer-based insurance, they're all over the board as well. $645 from the Kaiser Health Information Service. That's about the average nationwide. Certainly there are people less than that. There are people that pay more than that. And then $200 a month in copays. That's an average based on, a year. So now you can see that oftentimes employer-based health insurance is more expensive than Medicare. But again, that's, with a lot of caveats because everybody's situation is different. So let's look a little bit deeper into Medicare Part B. So again, it covers things like doctor's visits, outpatient care, preventative services like the physicals and vaccines and things like that, and durable medical equipment. So if you needed something like a walker or wheelchair, your Medicare Part B is the thing that was going to help you pay for those. So again, back to the penalty for Medicare Part B. So for the individuals that seem to have those questions, what if you get Medicare Part A and you don't get Medicare Part B right away? The penalty is kind of severe, and it is for the rest of your life. So it's not something you just pay once and be done with it. The penalty is an additional 10% of your calculated monthly Medicare Part B premium. And that is for the rest of your life. So in the example here, if you signed up 2 years late, you would have a 20% penalty. So 10% each year you don't sign up. And so if you look at what that Medicare Part B premium is for any given year, next year it's $164.90. So that penalty would be $32.98 You have to add that into it. So you come up with your new penalty premium for Part B, be $197.88. So you can see, I actually had a client, she canceled her Part B because she was still working and she felt she didn't need it. 10 years later, she had health problems. And so you can do the math. Her penalty was exceptionally high. So that's why you just want to make sure you speak with a trained individual to find out what your needs are and when you should sign up for Medicare so you can avoid any of that.
We have two other questions.
Sure, sir.
Does Part B include vision, dental, pharmaceuticals?
So Medicare Part B itself does not include those types of things. Those are provided either through a Medicare Advantage plan or a Medigap plan and a prescription plan. So we'll talk about that as well on the preceding slides.
Okay, and there's one other question.
Sure.
Was my understanding is that there isn't a penalty if you maintain credible coverage. Is that correct?
Correct. So yeah, we've had people that haven't retired until they were into their 80s, and they were working their entire time. They got Medicare Part A when they turned 65. They didn't have to get Medicare Part B because they did have that credible coverage. They were still working, and then when they retired, so just like you have to prove with your taxes now, especially in Massachusetts, that you've had creditable coverage all these years, it'd be the same thing. You would just prove to Medicare that you had creditable coverage during that time period. And then whenever you retire, you go on Medicare Part B without any penalty. The only times you would run into that problem is if you weren't able to verify that you had creditable coverage during that time period. So as I said, the standard Medicare Part B premium is $164.90, but that's if your taxable income as a single individual is below 97,000, or if you file jointly as a married couple below 194,000. That captures most of our clients, but again, there are people who, I have a lot of nurses who are retiring as clients, and or other professionals who make a pretty good salary. This figure here, this income figure, is based on your adjusted gross income on your taxes 2 years prior. So if you were to go on Medicare next year in 2023, they would be looking at your adjusted gross income from 2021. And so if you were still working, then your income may be higher than that 97,000 or even 194,000 if you're a married couple. So you can see that your Medicare Part B premium would be higher. It next jumps up to $230.80. But again, that is calculated every 2 years. So what you would typically find is if you retire, say you retire in 2023, they're looking at your 2021 taxes. You're still working, it's going to be higher. You may be in that higher monthly premium. But then the next year, again, you still may be in there because you were still working that year. But now in your third year, you're retired, you're not getting the same income. Maybe you fall below those figures and you're back down to that standard $164.90 premium. So hopefully that helps clear that. So let's jump into, so again, one of your options, again, I try to remember that screen back here, where again, you have original Medicare, A and B. Now we're going to talk about the supplements that you can add to that. We'll start with Medicare Part C. Right here, commonly called Medicare Advantage. So these are Medicare approved plans. They're all presented to you from private insurance companies. So that's something that I want you to understand. Original Medicare Part A and B, that's provided directly to you from Medicare, from the federal government. If you have questions about that or problems with that, you're going to be talking with a federal employee at Centers for Medicare and Medicaid Services. Your supplements, on the other hand, are all provided to you by private insurance companies. They have to follow rules and they have to be approved by Medicare, but they are private insurance companies. If your mailbox is full right now, it's probably because of all these private insurance companies sending you information about their various plans. And that's where a lot of confusion comes in. So most of these Medicare Part B C plans, excuse me, are HMOs or PPOs. So you might be familiar with those as through your working life. You probably had an HMO or a PPO through your employer. So you probably have a good understanding of how they work. So generally they have a monthly premium that you have to pay every month, whether you use your insurance or not. You have co-pays as you use things. So if you go see a doctor or a specialist, there's a co-pay. You have to have an x-ray or something like that, there's another co-pay. There are deductibles. Sometimes you have to pay the first certain amount of money out of your pocket before the plan kicks in and helps you. And then there are oftentimes out-of-pocket limits. So like if you have a catastrophic, you're hospitalized and you have to have surgery or something like that, your typical HMO or PPO, you may have to pay a certain amount, but then they have a limit after which that plan pays the remaining of your cost. And so these are, like you're probably used to now, the HMOs and PPOs, these Medicare Advantage plans, they work within a managed care network. That means some doctors are in the plan, some doctors are not. You probably have run into this yourself. You get a notice that your doctor is no longer accepting the health insurance that you have. And then you have the option to either pick another health insurance plan that your doctor accepts, or you're out picking another doctor. So same thing with this situation with Medicare Advantage. And it's important to understand that these Medicare Advantage plans and their networks are subject to change every year. So once you're on Medicare, it's not a done deal. You can't just pick a plan when you retire and then figure you're good to go for the rest of your life. These plans change, and sometimes in fairly significant ways. So it's something that you should review every year. And that's why they give you that open enrollment period going on now. Again, October 15th to December 7th. It's a good thing, even if you've got plans, to review that with a professional and figure out if you've got the best plan for you. So Medicare Part D. So again, this is another type of supplement that you can purchase. It helps cover the cost of prescription drugs. Again, they're operated by private insurance companies, regulated by Medicare. These Medicare Part D plans, they work with if you're just getting original Medicare A and B, and or you're adding in a Medigap policy. Down the bottom there, it says, remember, prescription coverage is built into your Medicare Part C plan. So if you picked a Medicare Advantage plan, it has a prescription coverage built into it. But if you're not going with Medicare Advantage and you're just going to stay with original Medicare, or you're adding in a Medigap policy, and again, we'll talk more about what those are, you would also want to choose a Medicare prescription plan to go along with that. So Medicare Part D so these again, even if you've got one of these built into your Medicare Advantage plans, it's good to understand how your prescription coverage works. So drug prices throughout the different plans that you can choose from, they vary widely. So usually when I help people with this, I'll enter their prescriptions and then I'll get a readout from that plan finder tool that will show me the cost for that person's set of prescriptions across, there's probably 20 to 30 different plans you have to choose from. The difference in cost between the lowest cost plan and the highest cost plan could literally be thousands of dollars a year. So it's not just tinkering here and there around the edges with the prices. They can vary widely. So that's another reason why you want to look at your coverage every year to see that you're maximizing your cost. So again, the Medicare Part D plans, they have monthly premiums if you're getting a standalone Medicare prescription plan. They oftentimes have an annual deductible, so you pay the first however many hundreds of dollars first. And then each prescription comes with its own copays. And then to confuse things more, these Medicare prescription plans and even your Medicare Advantage plans, there are actually 4 phases of coverage and cost. So, and this all will make a little bit more sense if your eyes are glazing over right now when we go through the plan finder tool after these slides. I'm giving you real world examples of how you wind up finding out which plan works best for you, because you want to see how your set of prescriptions and your medical care costs fit within this structure. So the 4 phases basically are: you have a deductible period. That means if you get your new plan, you go to the pharmacy on January 2nd, and you get all of your prescriptions filled, and you have a $500 deductible, you're paying the first $500. If the true cost of your prescriptions were $1,000, well, you just paid $500, and now the plan is kicking in, and you're going to save money on the rest of that. Then after you pay your deductible, you're in what's known as the initial phase. And that is usually where the plan is helping pay for that. Some of prescriptions, some generics, maybe zero copays for those. So you can see your real cost savings there in that initial phase. After you and your plan have paid a total of $4,660 for your prescriptions, you go into what's known as a coverage gap. You've probably heard that thrown around, the donut hole. This is a phase where your costs are changing. When these first started out, it was simpler to understand because your costs generally skyrocketed when you went into the coverage gap. Now it's a mixed bag. Some costs go up, some prescription costs go down. It's a confusing thing, but again, utilizing the Plan Finder tool or working with a professional like a Shine counselor, you can figure out how this affects you. And then after the coverage gap, if you have exceedingly high prescription costs, and you and your plan have spent a total of $7,400, now you go into catastrophic coverage. Traditionally, that means that the plan comes in and pays even more of your prescription costs than they were before. But again, now it's kind of a mixed bag. It depends on the prescriptions. And again, we'll show you how that plays out when we look at the website. So switching gears from the Medicare Advantage plans, that is one option you have to kind of fill in the gaps that are not covered by that Medicare A and B. Another option is a Medigap plan. So again, these are private supplemental health insurance plans offered by private health insurance. And you need to have Medicare A and B in order to have a Medigap policy. In Massachusetts, there's really only 2 basic options for Medigap plan. There are core plans and Supplement 1 or Supplement 1A policies, and I'll explain the differences there as well. But an important thing to remember is that all Medigap policies, also all core policies, all have to be the same. So regardless of where you purchase your core policy from, they all offer the exact same coverage. The only difference is in price. And that goes for the same with the Supplement 1 or Supplement 1A. You can purchase, there's probably half a dozen or so companies that offer these plans. All the plans are the same. They only differ in price. So that's because Massachusetts highly regulates what these plans can and cannot offer. And so they all offer the exact same thing. So hopefully that's not too confusing. You might understand that a little bit more as we go along. The way that these Medigap policies work is if you go see a doctor, they will bill Medicare. Medicare will typically pay its 80%. And that 20%, they'll just bill to your Medigap plan. And you won't see anything. You won't see a copay, a deductible, or anything. You just pay your 1 monthly premium, and pretty much all the other costs are absorbed by your supplement. So let's go on to, so this is a little graph. It's from the Medicare website.
And maybe just before you move on.
Oh, yep, sorry.
We did have a question. If one chooses a Medigap policy, it does not include drug coverage. Is that correct?
That is correct, right. So as I pointed out earlier, you would want to get, sorry, yes. So again, if you're choosing a Medigap policy here, you would want to add a Medicare prescription drug plan, what we call a standalone prescription drug plan, Part D. You'd want to add that in there. If you're choosing to get a Medicare Advantage plan, a Medicare Part C plan, it has that drug coverage built into it. I hope that answers your questions.
We got a thanks.
So
Thank you, Charlie.
that's one. Okay. 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 Where were we at? Okay. The Medigap policies. So here's just a basic. So you can look at it yourself more and do some more digging if you're choosing to purchase a Medigap policy. Generally, my advice on Medigap policies are to just go with the Supplement 1, or what's now known as the Supplement 1A. The core plans can kind of leave, if you have a catastrophic health problem, your core plan is going to leave you lacking from significant coverage. I don't say it jokingly, but you can literally get hit by a bus, have an ambulance ride to the hospital, be in the ER, have surgery, be in the hospital for a week or two, and go on to extended acute rehab, where you're getting, like a Spalding or something like that, and getting rehabilitative services for a few months and get back home with a visiting nurse. And you might need a wheelchair at some point and a walker, hopefully at some point, and other durable medical equipment. If you've got a Medigap Supplement 1, you would not see one bill for that at all. You just have to pay your monthly premium. But with a core plan, that's not going to be the case in that situation. So if you're going to spend the extra money, because they are more expensive than Medicare Advantage plans, it's generally just worth it to go with a Supplement 1. I can try to answer more questions if you have about that at the end. But
We do have one more question here.
Sure, yeah.
I have heard and read in the Medicare information, if someone signs up for Medicare Advantage, it is sometimes difficult to go back to a Medicare supplement plan in the future. Why is that? Sounds like Medicare is penalizing us for going to a private insurer.
So I'm not sure where you heard that. My guess, if you read that somewhere, it might have been from a private insurance company that's selling Medicare Advantage plans. So we're here today to talk about health insurance, but as you probably all have experience dealing with insurance companies, if you ever had a car accident or anything like that, or you had a problem with your roof and you had to get your homeowner's insurance involved, they can be complicated to deal with, and they're not always as friendly when you're trying to make a claim. So there's a lot of misinformation out there. You have an open enrollment. So if you're going along and you've got Medicare and you've got a supplement like a Medicare Advantage plan, and you want to change, you generally have to wait till the open enrollment period and then make your change then, and do that to start at the first of the year. But there should be no complications in going from a Medicare Advantage plan to a Medigap policy at any time you feel that's warranted. The only thing you have to remember there is when you switch to Medigap policy, like a Supplement 1, you don't have prescription coverage. So you will have to find a Medicare prescription plan, a Part D plan to go with that. And again, that's where when we go to our second phase of this presentation, we'll be going through the website and I'll show you how to do that. Or you can talk with a Shine counselor. They are trained to help you figure out how to switch from that Medicare Advantage plan to a Medigap policy along with prescription coverage. So here's kind of a side-by-side comparison between the Medicare Advantage plan and the Medigap policies. So the big advantages to the Medicare Advantage plans are
I'm sorry, Dan, to interrupt. Just to
yeah, no problem.
Is Medigap Part B and any different from Medigap policy supplement, which includes prescriptions?
Okay, so again, the supplement that includes prescriptions built into it is this Medicare Advantage plan. That's Part C. So again, apologize, it's going back to our screen here. So again, remember, when you sign up for Medicare, if you're fully retired and you're fully on Medicare, you have Medicare Part A and B. Again, that's original Medicare. Everything else is an add-on, and it's provided by private insurance companies. your choice again is choosing a Medicare Part C or a Medicare Advantage plan. Again, those have prescription coverage built into it. Or you, instead of picking a Part C, you may pick a Medigap policy, like a Supplement 1, and you would then also have to pick a Part D to go with that to cover your prescriptions. So those are two distinctive pathways. You're either going down and so we'll come to our screen here. We'll come to our screen. So look at these two columns here, the Medicare Advantage plan on the left and the Medigap policy on the right. Those are two separate pathways. You would choose to go down one or the other. And again, you shouldn't have any problems switching during your open enrollment period between these two options. But let's say you go down the Medicare Advantage plan. Some of the benefits of these plans, they generally have lower premiums. There are probably half a dozen or more plans out there that are called zero premium plans. So you pay no premium at all. So you only are encountering cost when you use your healthcare. When you go to your doctor, you may have a copay. It could be $10, it could be $25. You would know what it was ahead of time, and you would know what deductibles there are. Like if a lot of these plans, again, have zero premium. So say you just go and get your physical is free. And say you go to the doctor one other time, you got an illness and you went to the doctor and they wanted you to get some blood work done. You'd pay a copay for your office visit, and you'd pay maybe a deductible to have the lab work done. That's the only time that you're paying out of pocket to utilize your health insurance that year. So for somebody who's otherwise relatively healthy, or maybe only has to see their doctor a few times, or maybe you have a diagnosis that's fairly well managed, Medicare Advantage plans can be real cost savers for you. I'll explain a little bit more when we go through the web page of costs that you have to be aware of. But again, if you're otherwise relatively healthy, Medicare Advantage plans can be real cost savers. On the other hand, the Medigap policies, you're not paying out of pocket when you utilize your services, but you are paying a much higher premium. You can see here for core plans, the average here in Massachusetts is anywhere from $114 to $204 a month. So whether you see your doctor or you don't, you're paying that monthly premium. The Supplement 1 or Supplement 1A, these range anywhere from about $166 to $320. So a big range there. Again, all Supplement 1A plans are exactly alike. So whether you're paying $166 or you're paying $320, you're getting the exact same thing. But with those, you have no deductibles, no copays. You basically have no out-of-pocket costs beyond paying that premium. So again, in that scenario, you could have a catastrophic medical problem, be in the hospital, surgeries, rehab, at home with assistance, and you're only paying your premium. So that is, those plans, they work pretty well. If you're somebody who's very risk averse, it's a good way of kind of capping your costs. So for a predetermined monthly premium, you're not going to have any other out-of-pocket expenses, except for your prescription copays. Again, we'll get into that as we go along. Whereas with your Medicare Advantage plan, if you're relatively healthy, you save a lot of money. If you do have a catastrophic illness or something like that, your cost will go up, but you can see those, and if you're a good planner, you can plan for those. So again, it's two different pathways: Medicare Advantage or Medigap. Again, each year you can switch. So if we don't have any other questions about that right now, we'll proceed and yep. So some key points to remember. Medicare will always be the core of your health insurance. Once you go on Medicare, it'll likely be your insurance for life. It's always there. Regardless of what other supplement comes along or that you choose, you always retain your Medicare A and B. That's your benefit. That's a federal benefit. You've paid into the system. That's your benefit. You have that always. So don't allow anybody to tell you like, oh, you don't have Medicare, or don't think that, oh, well, I have Tufts or I have Harvard Pilgrim. I don't have Medicare. You'll always have Medicare. It's always at the core of your health insurance. So you should never disenroll from Medicare Part A or B. There really isn't a scenario where, unless you retired and then you went back to work. Other than that, there really isn't any scenario that I can see where it would make sense to disenroll from Medicare Part A or B. I told you that story. I had that client. She was, she had retired. She went back to work. She disenrolled from Medicare Part B, forgot about it. 10 years later, now she's got this, but then she retired again and never got Medicare Part B. And now she is 10 years later with this huge penalty that she has to pay. Never trust advertisements or your crazy cousin. So you can't really take advice. You can't really talk to somebody and say, hey, I've been on Medicare for 5 years and I've got this plan and it's great. That doesn't mean it's going to be best for you. It's good for them. It definitely doesn't mean that it's going to be good for you. You have to go through that plan finder tool really to find the plan that works for you. And your aversion to risk and to cost may be very different calculation than somebody else's. So it's really an individual choice. And the advertisements are sent out there. They're manipulative, to say the least, and they don't always give you the information you need to make your decision. All the information you need to make your decision has to come really from that plan finder tool on the Medicare website. If you're savvy enough and you can learn to use that, you're golden. You're going to have all the information you need to make your choices. If you're not able to use that yourself, work with me if you're a client of ours, or work with a Shine counselor. It's the only way to really get the information that you need. And again, you should review your options every year because they do change quite a bit. And so right there, I have on that slide, the Shine counselor. There's an organization called Mass Options. And they have a phone number there. You can call them and they will connect you with your local Shine counselor. Generally speaking, if you live in a town, they probably have a council on aging or their own local elder services organization. You can call them as they usually have a Shine counselor available there.
So we did have another question.
Yep, certainly.
It was, how do you decide whether to select Medicare Advantage or Medigap policy?
That's a great segue into my next phase, and that's utilizing the website. So again, right here, that's the big plan. And again, I think to break down that decision to its simplest terms. Again, I usually, like, if you drive, if you're driving, you're getting car insurance. This is in some ways very similar to automobile insurance. If you're a safe driver and you drive a 10-year-old car, you don't need the most expensive insurance out there. You could probably get away with just getting your standard car insurance. Same thing with health insurance. If you're a relatively healthy person, or you just have something that is being monitored but managed by your healthcare providers, and you don't really foresee yourself having any kind of major medical problems, like you don't have like complicated diabetes or a complicated vascular problem or something like that, or you're not anticipating some kind of major surgery, like you've got some kidney disease or may need to go on dialysis. If you just have some routine, regular health situations that just need to be maintained, like a high blood pressure or a high cholesterol, you're probably fine going with a Medicare Advantage plan. You can save a lot of money. Again, there are these zero premium plans, but you have to be aware of what your out-of-pocket limits are. They can be high if you had a catastrophic coverage, but you can plan for that. I usually tell people to try to put away their own health savings plan. Just put aside some money if you're able to, especially now if you're still working and planning to retire. Set aside, if you're able to, set aside some money, a few $1,000s or more, that and leave it there in case you have health costs that are unexpected. And for most people in those circumstances, a Medicare Advantage plan will serve you well. If you're somebody who's just very risk averse, you don't want any surprises, you want that coverage and you can afford it, go with a Medigap policy. That's great coverage because I'm just going to pay my, somewhere in the neighborhood of $200 on average is a premium for a supplement one. You know that during that year, whatever kind of health outcomes you have, whatever you get hit by that bus or you have some kind of tragic news from your doctor, you're not paying more than that $200. There are added costs for your prescriptions. We're going to get into that in more detail now. But again, for one monthly premium, you don't have to worry about others.
So we do there is a bit of a follow-up question on that. So what do you recommend for someone with a chronic illness like rheumatoid arthritis that may need joint replacement surgeries, in the future?
Yeah, so again, remember, you can switch. So if you think that you're not going to have that surgery within the next year, you're probably okay going with a Medicare Advantage plan. Or if you've got a Medicare Advantage plan and you're thinking of switching, talk with your Medicare Advantage plan, talk with your practitioners and see what it may look like for you if you were to have that. So say you were to have like a knee replacement. What would that entail? And what would my Medicare Advantage plan cover and what wouldn't it cover? And if you can't get that information and you're really worried about that, it might make sense, like if you know now, switching to a Medigap policy. And you could do that for the year. If you anticipate like, yeah, I'm going to have knee surgery next year and I have like diabetes and I might have complications from that surgery and I'm really worried about what it might cost me. Going to a Medigap policy is not a bad idea for that year. So for that year, you're paying higher premiums, but you know that you're covered. And if you have your surgery and things work out well, and then the next year you're feeling better and things are working out, you could always switch back to a Medicare Advantage plan. So it's not a decision that you're making for life. It literally is a decision you should make each year, and you should base it on your circumstances at that time. I hope that helped. So I think, and again, remember, if you're a client of ours, you're welcome to give me a call, and I'm happy to talk with you about your specific situation and help you with that plan finder tool if you're not able to, or definitely reach out for a Shine counselor and get somebody that knows that, who doesn't work for an insurance company. If you find yourself calling an insurance company to ask about what's best for you, you may want to find somebody else to talk to. It's not that they're being disingenuous. It's just they have a profit motive involved. So I'm usually leery of that. If any advice is, try to seek somebody who doesn't have, that kind of bias. And I don't get paid by insurance companies. We at Senior Resource Center, we have no contracts with any insurance companies. I look at them, try to look at them as objectively as I can. And it usually comes down to, customer service and price. So that's usually where my advice comes in. So if we can now, if we don't have any questions right there on that part, we're going to try to switch gears to go over to the Medicare website. So I should be able to do this, learn correctly. Let's see. Sorry. All right. Okay, so you should be seeing the Medicare.gov website. Are we looking good, Scott?
Yeah. Nope. I'm still seeing the website. So it's an unshare.
Should I stop sharing and
yes.
then?
Yeah.
Okay.
Then, yeah. Sorry.
All right. Okay.
There you go.
All right, we got it. Okay, so for everybody, this is the Medicare.gov website. If you're still working and you're planning on retiring, once you get signed into Medicare, you should definitely go on this website, Medicare.gov, and you should sign up for an online account. You have to enter a little bit of information, but then it's your online account. It's a great place because all of your kind of health information that you get through Medicare is all contained in one place. All of your explanations of benefits, if you're familiar with those, probably from any health insurance you have now, they can be very important documents. It's always good to review your explanation of benefits. It shows you, hey, you went to the doctor, this was done, this is what we paid as your insurance, and here's what you potentially can pay, or here's what your insurance will pay. It's a great way to do that. It's also a great way to make sure that nobody's utilizing your Medicare benefits and getting services unbeknownst to you, or Medicare fraud. So let's try to get through as much as we can of this website. I know we're looking at time. We spent a bit more time on that than I thought. So we're going to go through here. I'm going to show you how to utilize this website. So Medicare.gov, you go to.
Hey, Dan, maybe before you start, if my mom is on PACE and they denied a toothbridge recommendation by her dentist, can she use her retiree dental benefit to pay for this bridge and stay on PACE, or would we have to pay out of pocket for the bridge?
That's good. So this is a very specific question. This individual. PACE is a program. It's a mass health program. So you probably don't want to disenroll from PACE. My advice would be try to negotiate with PACE. They oftentimes, they may allow you to go outside of that if you do have secondary dental insurance and utilize that. I would think that they may be able to do that. So for you, I would talk with PACE and see if you can negotiate with them. Stay in the PACE program, more than likely, is the best advice, and see if they will allow you to go outside of their network to get that dental work done. Okay, so let's start with our website. So again, this is Medicare.gov. Don't want to go to Medicare.com or any other ones. This is Medicare.gov. This is the federal Medicare website. Up here at top, you want to go to health and drug plans, and you want to find health and drug plans. And this gives you two options. So if you're already fully retired and you're on Medicare, my advice would be over here would be to create your own individual account. That way, when you enter your medications, you only have to do it once, and you can do all of your research, and it will save all of your information here in your own account. I am not on Medicare myself yet, so I don't have an account. So what we're going to do is go over here, and we're going to continue without logging in as a Medicare recipient. And if you're not retired yet, or you're not fully on Medicare, this is one thing that you can use to kind of get some information about these plans. So you're going to start here. I'm going to look at coverage year 2023. We go to zip code. I'm going to use here Quincy 02169. Plan type. I want to look at Medicare Advantage plans, but I'm also going to consider some of the others. But if you click on Medicare Advantage plan, it will allow you to look at the other options as well. And then I'm going to apply that and start. That's going to ask you some questions here. Help with costs. So these are, so that other person who is on PACE, they're obviously have Medicaid. That's another program. It's different from Medicare. Medicaid is a program offered by the federal and state governments. You have to apply for it. You have to meet very specific eligibility criteria. So for today's purposes, we're not getting any help from anybody. It's just us and Medicare. So we're going to click, I don't get any extra help. We go next. Do you want to see you can compare drug costs? We definitely do. That's why we're here. We click on yes, and we go next. And so that brings you to a screen where it gives you an opportunity to enter your medications. I'm lucky I'm pretty healthy and I'm not on any medications, but there are many medications that are shared amongst many of our populations. I'm going to just enter some of those real quick, and I'll show you how to do that. So one thing is, make sure I spell it right. So simvastatin. Simvastatin is pretty common prescription medications for people whose cholesterol might be a little bit high. I enter that in there, pick my drug, I'm going to add it to my list. Then it gives you the opportunity to put in like how many milligrams you take. We're going to take pretty standard 20 milligrams. This has 45 days, but we only take it once a day. So we're going to we take 30 every month. And then we're going to add that to our list. And we're going to add 2 other drugs just so you can get a handle on this. Another one typically is lisinopril, picked from our list. This is a medication that helps with high blood pressure. We're going to add that. Again, we take a low dose, just 10 milligrams. We take it once a day, every month, and we're going to add that to our list. Now we got our lisinopril and simvastatin on our list. I'm going to add one more medication. This one is a bit more expensive. Eliquis. It is a brand name drug. It's not a generic, and so it tends to be more expensive. If you ever had to purchase this medication without any coverage from insurance, it can be extremely expensive. It can literally be in the $1,000s or more. We're going to add this medication. We take it twice a day. So you can see here our quantity is 60, and it's every month. And we're going to add that to our list. So there we've got our 3 medications that we take, and we're done adding medications. Now we're in zip code 02169 here in Quincy. If you know your pharmacy, you can enter it here. You can ask it to find local pharmacies. What I generally do here is I always click on mail order. A lot of people use mail order. They use it for some medications, maybe not all, but for comparisons, we like to click on that. And then I'm just going to use CVS. It's a pretty common brand. There's one on every street corner. I'm going to add that one. And then I'm going to be done with adding my pharmacies. But if you use Walgreens or something like that, here's your opportunity to add that in here. So now I've effectively entered my information that allows the Plan Finder tool to start looking at it. So right now, what we're going to look at is Medicare Advantage plans. So right here, it says showing 10 of 41 available Medicare Advantage plans. So in this area, there are 41 different Medicare Advantage plans that we can pick from. So that's a lot of choices, but generally, one of the big factors in deciding that is looking at cost as well. So let's look at, and these are, so excuse me, screen is right here. That. So you can see this little drop-down menu here. You can choose between a few different options of viewing this screen. I go with lowest drug and premium cost. That's the best way of doing it, I think, because it now lists all 41 plans in ascending cost. So we're seeing the lowest cost plan first. And so what it's got for us is this Medicare PPO Blue Saver RX. So a PPO differs from an HMO in it's a preferred provider organization. PPOs generally they still have networks a little bit, but they're looser. You can generally go to more doctors under a PPO than you can under an HMO, which has very specific networks, very specific set of providers that you can go to. So here you can see a breakdown of our cost and what they cover. So again, this is the Medicare PPO Blue Saver RX. Again, Medicare Advantage plans come with built-in prescription plans. This plan is offered by Blue Cross Blue Shield of Massachusetts. It is a 0 premium plan. That means if you just get a physical once a year, you're not paying anything for your health care. The only thing you're going to have out of pocket is, again, your co-pays for your prescriptions. And this is calculated that my 3 prescriptions, I'll pay roughly about $917 for the year for those prescriptions.
Again, would you enter your doctor's names and preferred hospitals? That was one of the questions we had here.
No, not on here. You wouldn't. So what I usually advise people to do if you're planning on picking a Medicare Advantage plan, before you go on here on the Plan Finder tool, is talk with your doctors. If you have 1 doctor or 3 doctors, talk with them, find out what plans they are accepting this coming year. They'll probably have maybe 3, 4, 5 plans that they work with. Now you've just reduced your options there. If you want to stick with your doctors, now you've just lowered your choices. You really only now have to choose between one of those 3 to 5 plans that your doctor gets. So you've made your life a little bit simpler. Rather than looking at all 41, you only have to look at those 3, 4, or 5 plans that your doctor accepts. And you'll find those plans in here. If the doctor says we accept Blue Cross, you know you want to, and you want to pick maybe a Blue Cross plan. So you want to find the best Blue Cross plan that works for you. So here's a Blue Cross plan. This is the lowest cost plan for me under my scenario. It's a PPO, so more than likely my doctor would accept that. I have no monthly premium. I do have retail pharmacy costs. So if I go to CVS every month and get a 30-day supply of my medications, I'm likely to pay just over $900 for the year. And some of the other key factors in here, it does include some vision. It does include some dental, not all. It does include, so like hearing. Generally what they mean, they don't mean hearing aids. They generally mean hearing exams. There's no transportation provided by this, but there is a fitness benefit. Likely I save some money if I go to the gym. Worldwide emergency, that means if I'm traveling outside of the state or the country, I can utilize my insurance. And there is telehealth, which means I have the opportunity to get on a Zoom with my doctor and show him my funny thing growing under my arm. Some of the other costs that you might have. So there's a zero health premium. That means if you go to your doctor, you don't have any deductible. There's no drug deductible. That means if you go to that pharmacy on January 2nd, you're not going to pay any deductible. You're going to immediately start seeing savings based on whatever the particular medications are. Here's an important part. These out-of-pocket costs here. You can see in and out of network, $8,950. Then they give you this in-network, it's $5,600. So it's a little confusing when you get to a PPO because oftentimes they say, oh, there really isn't really a network, but there actually is a network. Excuse me. So
Dan, is there a way to find the detail of the benefit itself?
yeah, so you can get into more details here. So these are just the overviews, and you can then get down into plan details.
Gotcha.
And that's where it gets, you get really down into the weeds with what the costs are. So you can see them here: total premium 0, health premium 0, drug premium 0. It does tell you, yes, you do have to pay your Medicare Part B premium. Again, for most, that's somewhere in that $164 a month range. Drug deductible, no. These are maximum you pay for health services. So you look at this thing, once you spend this amount for covered services in a year, your plan pays 100% of your care. So you know that, again, in that scenario, you get hit by a bus, you're probably going to be paying somewhere in around this out of pocket. But you know that you're not going to pay any more than that. Your plan, if your costs and if you did get hit by a bus, your costs are going to be astronomically higher than this $8,000. You're probably going to be in the $100,000 range or even higher. So you can see that your max out of pocket is this. So again, if you're not as risk averse as some others, you're thinking like, I'm looking both ways when I cross the street, I'm not going to get hit by a bus, I'm going to go with this plan and just hope for the best. So one of these plans might be very good for you. So other costs really are generated, and this is, if you see your doctor. So if you go see a doctor in network, there's 0 copay. If you see a doctor outside of their network, there's a $25 copay per visit. If you see a specialist, so say your doc says, I hear something funny in your heart, I want you to go see a cardiologist. In network, again, you could be 0, but it could be as high as $45. If you go out of network, it's $25 up to $55. So you know in advance that might be a cost. Diagnostic tests like some different tests in the network, again, 0. Out of network, you got a 45% coinsurance. So if your diagnostic test, that could be like an MRI. If it costs like $1,000, you're paying 45% of that, so $450.
Well, a question here was, are there Bernadette, please don't move to Canada. We don't want that. But
Yeah,
are the drug company rebate, this is from Elizabeth, are the drug company rebate savings cards, FSA, are they accepting these programs?
So you may be able to combine them. So the best person to talk to that about generally is your pharmacist. So most pharmacists, like if you go to CVS or Walgreens or wherever, most pharmacists are very knowledgeable about these plans, and they have their computer system has you built into it already. So if you've got a Medicare plan and a Medicare Advantage plan or a Medicare Part D plan, more than likely your pharmacist has that information when they pull you up in their system. And you can talk with them about what other savings plans works with this or not. Like I lied earlier, I do take a prescription medications and eye drop, and it can be expensive. I utilize, with my existing insurance, I utilize a manufacturer rebate that I'm eligible for. It saves me a lot of money on that. So it's really on a case-by-case basis. Different medications have different savings plans. Best to talk with your pharmacist about that. And yes, Canada is very nice, but you don't have to move to Canada. I know I'm going through this very fast, but
And yeah, and just in keeping with time, keeping people,
Sure,
you know, probably at that time where people wanted. So if there are any other questions or anything like that, I don't know if there was
okay.
any closing thoughts you might have.
Yeah, if I could just close out with, let me just show you a little bit more. The power of this plan finder tool really comes in when you're looking at prescription costs as well. So here is your drug coverage. So this shows you, if you go to a CVS pharmacy, this is what the big driver of your cost is going to be the Eliquis, that $915. That's for the year of what you'd pay for Eliquis. And this is generally how it's broken down. Excuse me. They can break it down by month. So month one, you're basically paying $42 a month for your Eliquis for the first several months of the year. But then here's where you fall into the donut hole. That coverage gap you fall into in September. And now your $42 copay for that Eliquis just jumped up to about $145 for the rest of the year. You're paying that higher amount. As long as you know that up front, you can plan for that. You can space it out over the year and not be surprised. But that's why you need this plan finder tool to show you that. So I can break it down here by prescription cost. Here are my 3 prescriptions: Eliquis, lisinopril, and simvastatin. The big driver of mine is the Eliquis. After the deductible is paid, I'm paying $42 a month. When I go in the coverage gap, I'm paying $144. If I get through the coverage gap, which I don't happen to do this year, that cost goes down to $28. The lisinopril and the simvastatin are very inexpensive generics. And you can see I'm only paying anywhere from $0 to maybe $1.90 a month for those prescriptions. Not real drivers of the cost of my healthcare for the year. But you can see if you get a brand name, non-generic medication, these costs can go up quite a bit. So that's why you definitely want to learn how to use this plan finder tool, or again, speak with somebody like myself or a Shine counselor. So I hope I didn't scare the hell out of everybody. I hope I gave you some tools here again.
Well,
This is the
just as a
Medicare.gov
yep,
website.
just as a reminder, we can make this available, our presentation. So if you just want to text me in the chat, I actually included my email a few times, but it's scampbell, SCAMPBELL @helpingothers.com. And if you send that, we'll send it right out to you.
All right. Did we have any last questions?
I think we're good.
All right. Okay. Hope you're still breathing and stay well.
Thank you so much.
All right. Thank you.